name is Amanda Camacho, and I'm one of the lactation consultants working for the MUHC. And I'm making a video for the Montreal Children's Hospital parents who are here in the NICU on how to maximize your milk production. So there's 5 steps to consider when you're trying to improve your milk supply. Step number 1 is to start expressing your milk early and often. So as soon as possible after the birth, start expressing the milk and continue expressing it 8 times a day, each day after that. The reason we need to express so often is because babies feed at least 8 times a day when they're newborns. It's also important, it spaces the feeds out at about every 3 hours, so it's important to remember to try and pump at night also, especially even just once at night, even if you're doing a bit longer stretches between the pump sessions at night, because sometimes you can do it every 2 hours, sometimes every 4, as long as you're 8 times in 24 hours. But at least keep 1 pump session at night, and the reason is because the milk-making hormones are quite high at night, so you're going to be taking good advantage of those hormones by having at least 1 session. And I know that it's really hard to wake up at night and you need an alarm. Maybe a family member or a partner would be willing to wake up with you, but it can really benefit your milk supply long term. So 1, early and often. 2, use your hands well when you're pumping. So if you're in the first few days of your milk expression, then you have colostrum and you want to manually express the few drops first and then put the pump on as to stimulate. Once your milk is mature, what you're going to do is start with the pump, and while the pump is going, you still want to use your hands so that you're compressing and massaging the breast to make sure you're getting all of the milk all out of the glands. The pump on its own is not 100% effective. So without your hands, you could be leaving large amounts of milk in the breast and not getting all the milk that you want to get out. So that's something important to consider. Number 3 is that you want to do skin to skin, otherwise known as kangaroo care. So having a close contact with the baby, especially on our body, boosts all those hormones we need to make the milk. If you're not able to hold your baby on you yet, you can bring your body to the baby in their bed or even just your hands with the baby. Also, it's been shown that just pumping in your baby's room increases supply. And it's because those connection hormones, that oxytocin of our bond with our baby, helps increase the amount of milk we're making. So it often increases after holding our baby skin to skin. And even when we're at home, if we're looking at videos of our baby, or a picture of our baby, or smelling our baby's blanket, it can increase our milk supply as well. Number 4 is use a hospital grade pump. So there's a hospital grade pump in each one of the rooms like this, and they are also available at local pharmacies in the community for rent. And you are able to use the kit that we give you in the pump in the rental pump that you might rent at home. The reason we recommend the rental grade pump is because they are studied and shown to be the most effective pumps, especially when you're trying to establish supply. If you're not able to rent a hospital grade pump and you have purchased a pump instead, you want to try and purchase a pump that can pump simultaneously, so both breasts at the same time. In pumping both sides at the same time, we're giving a stronger stimulus to the body, and generally the production is better. Of course, when you have both of them here and you're holding them, it's difficult to massage the breasts. So you want to put them on first, let 10 minutes go by to let the pump do most of the work. Then you're going to put one pump down. You're going to concentrate on massaging one side before you finish to make sure it's all empty. Then you're going to switch to the next side, make sure that everything is completely empty with your hands on. Some moms find it easier to do this by having a pumping bra that simply holds the pump on itself, so it allows you to be hands-free, which can be much more relaxing for the shoulders and much more pleasant for pumping. There are pump bras that are sold, but you can also easily make one by just having a sports bra and cutting some holes in the front to pass the pump through. Number 5, the last one, is to keep a log. So keep track of the volumes of milk that you are making each session. So on the back of our instructions for the pump, you'll see a little log chart that you can record each of the pump volumes that you're making and see from day to day if your volumes are going up. The volumes are not going to be the same or even increasing from each session, but we want to see in a full 24-hour period compared to the next that there's slowly an increase in volume. The ideal volume to get to is about 750 milliliters by about 2 weeks after giving birth to your baby. So if you have done all of these steps, right, so pumping early and often, including at night, doing hands-on pumping with the pump, along with some manual expression if it's early, kangaroo care, which is a fancy way of saying skin to skin with your baby or close touch with your baby. 4, using a hospital grade pump and pumping both sides simultaneously. And 5, keeping a log. If we've tried all of these things and you're seeing that your milk supply is not increasing, then please ask to speak to us and get some help, because we'll talk to you about other strategies we can use, and possibly talking to your doctor about medication you could take to increase your supply. I really have to kind of make sure all these other parts are checked off. But that should get you on the right road to maximizing your milk production for your baby. Thanks.